how do you see diabetes care wrapped into the whole accountable care organization and where healthcare reform is going? How do you see this rolling up into all of this?
Okay. So I think realistically, and more than 80% of patients with diabetes are going to receive their care in the primary care physician offices. And that's where they should be receiving their care. So that's where in the patient-centered medical home, you're going to see diabetes management delivered to the majority of patients. I think that what we need to see happen is, number one, the patient-centered medical home needs to have adequate resources to manage the diabetes in a multidisciplinary way to ensure that patients have access to education as well as medical management. Number two, there are ways that we could envisage, for example, specialists sporadically spending time in this patient-centered medical home to see some of the more difficult to control patients, and possibly even identifying which patients need longer-term follow-up at a specialist level, such as at Joslin, and to work with primary care physicians in a collaborative way to ensure that that happens.
So on some of the new technologies like gene sequencing or molecular diagnostics, do you see that having an impact on substratifying patients or that are some subclassification of diabetes or even pre-diabetic so that we can get to them sooner?
So I think that we will need to get a better understanding of just more specifically what is type 2 diabetes, because at the moment it's a heterogeneous group of conditions. And trying to understand at a molecular level what are the more basic fundamental defects that patients are suffering from may enable more targeting of therapy. As an example, patients with maturity onset diabetes, MODY, maturity onset diabetes of the young, by understanding the genetic abnormality, we may enable therapy to be directed in a different way, aimed at them in a different way. So I do think that with time we're going to see a more need for understanding or to try to subclassify these forms of diabetes and to understand the genetic predisposition as well, so that you can target different interventions.
So you've said technology a number of times. So you actually believe that technology will have an impact on diabetes care and outcomes?
Yes, I think so.
Do we have any studies?
There's no long-term data. That study that I showed at the end was probably the longest study that there is. It's less than a year, I think. But there's no long-term studies. I think part of the problem is the fact that because up until now none of this has been reimbursed, people have been reluctant to invest in combining technology with the intellectual component, the educational and the therapeutic components for patients, because there's no economic model to support it. I think that the opportunity now is that we're entering a new era of accountability in terms of for healthcare, and maybe now we can see opportunities to integrate this into the chronic disease management program for patients, notwithstanding the fact that if you look at the projected increase in diabetes, not only in the United States but in the rest of the world, the number of physicians that there are being trained is not keeping pace with the projected rate of increase in diabetes. So diabetes is going to overwhelm the healthcare system. We have to find new ways of dealing with it.
My final question to kind of broach the 800-pound gorilla that's usually in the room for food. What do food companies need to be? I mean, food companies have a major role to play in diabetes management. What do we suggest that they?
I think that it's not just the food companies. It's a public health issue. Food companies are responsible, have a big responsibility, but it's an entire public health issue. It's when you look at some of the staggering statistics about how many millions of dollars are spent marketing food products, and they're targeted at children. So from a young age, the kids are being exposed to these adverts about how great these candies are and these these sugary drinks are, and so on and so forth. We've got a huge problem on our hands that includes the food companies, but will include other players as well, that need to work together to address the problem. We have to stem the tide of obesity, obviously, in the first place.